This is Dr. Maria Pirona, who is the director of the medical clinic here at Wesley Medical Clinic on the seminary campus, pediatrician, pastor, graduate student in the seminary, has a PhD in family practice, and just one of the most remarkable people I know. She also has a vision, a dream for dealing with the problem that is infecting all of Venezuelan culture: teenage pregnancy, promiscuity, STDs, single-parent families. And she's developing a ministry called Una Esperanza, One Hope, to address these great needs that are impacting this whole culture. Dr. Maria, how do you hope to address all of this problem that exists in Venezuela?
The young lady that is pregnant, understanding a teenager is someone that is between 11 and 19 years old, and this is a stage of life in which the young person is adapting to adulthood, growing into adulthood, and has gone through changes both physically and emotionally. And at this stage, to become pregnant is a dangerous and risky situation, because the teenager, it's a girl that is just about to become an adult, both mentally and physically, but she's not there yet. And not having a body and a mind fully developed will have negative consequences in the case of becoming pregnant. They can experience a miscarriage, the interruption, spontaneous and natural interruption due to physical conditions, or they resort to getting an abortion to interrupt the pregnancy. That can produce even more negative consequences for the health of the teenager. They can experience other health issues like high blood pressure, leading to preeclampsia, or when they deliver their babies, they have babies with low weight, underdeveloped in some way. Another consequence is that their partners abandon them, leave them, becoming single mothers that don't have a job, income source. They have nowhere or no one to turn to leave their babies under their care while they go away for getting a job or for an income. So they turn to prostitution. So this is a public health problem when we find teenagers that are pregnant. So we have to work on the prevention side to help prevent premature children, young women with health issues, and single mothers.
Dr. Maria, you've defined the problem pretty clearly. You understand what it is. You deal with it all the time. You live with it all the time. It's obvious to anyone who's just somewhat conscious of what's going on in Venezuela and the damage that's being done. But you've got a passion for this. It burns in your heart. It doesn't burn in everybody else. How or why do you have such a passion for this ministry?
I started working on the west side in a very economically depressed area in Barquisimeto, and I started to work with pregnant women. But when I saw how many teenagers were pregnant at that time, I opened my eyes to this situation, and I noticed that there was a problem there. So a passion started to increase in my heart. So I studied in sexual orientation, And my thesis was about preventing teenage pregnancy. So when I researched about the factors and the reasons why they became pregnant at this stage of life, the passion increased. And I wanted to get involved in the world and see how I could work and help and serve them, avoiding this. Sometimes their background is a background of abuse at home from their parents and relatives. So this passion increased and expressed in helping organize support groups, to talk to groups and talk to students at schools. And I thought of starting a ministry that can help them, even with all the lab work and the medical attention that they need, because there's nothing like this, an institution or organization that focuses on them, that would focus on the teenagers that are in the risk of becoming pregnant. And currently we don't have prevention or attention to this sector, this group of our population. So this passion led me to get trained, and also ideas on how we could help. This is how the project My Hope was birthed.
Dr. Maria, I know that with Una Esperanza, you're already involved in addressing these needs that you so clearly understand, have a passion to address. What are some of the ways you're already helping and ways that you hope to help in the future with this?
We have mainly done this through the church that we have established and we pastored, my husband and I. And we help in the prevention area with talks that we take to schools and to barrios and places, so we can, in an orientation role, talk to them along with a team that we have put together, trained, so they can be oriented. And people at church and other places that are willing to help and are there to counsel, teachers, nurses, social workers, professionals that are trained, and they're working on a volunteer basis. It's been slow because of our lack of resources. And another thing that we do is that we partner with schools. Last Saturday, we taught a workshop on prevention, and we did it in our church. And we called for volunteers that wanted to come and join with us, helping preventing teenagers become pregnant and trying to prevent drug abuse and other situations that we find in these barrios. And we had several people coming in as volunteers to help us.
Dr. Pirona, with the development of Una Esperanza, there are people back in the United States who are very passionate about this. Some of them have been involved with it for 25 years or more that I've worked with, dealing with the same kind of things. They've developed programs and materials and are involved in the very same social issues that you're involved with here, except the poverty here makes it even greater. They've sent some materials down for you that I want to present to you that you can use with the ministry here. They're also raising money, and some of them would love to come down and partner with you to teach or to care for these young girls or children, to partner alongside you to help support what you're doing. How from your perspective, how can the Church in the United States best help provide the one hope, Una Esperanza, that these young girls and at-risk children need so desperately here in Venezuela?
One of the studies and research studies in this field, in this area, points at the need of a good sexual education program as part of the education in schools, and this calls for people that are trained, professionals that have the tools to reach them. We are working now in the largest municipality in Latin America. It's like the largest county in Latin America is Juan de Villegas. And we're reaching out to them through these workshops. We desire to have a good program, something that we can use for our youth to understand the sexuality in a healthy way, with a focus on prevention and how they become healthy and stay healthy in their sexual life. So we need computers, multimedia projectors, something as this manual that can be used, presentations, videos, multimedia programs, things that we might need, tools, and even partnering with people that are more advanced in this work and something that they have done, listen to their experience and the things that they have done in this field. And we have the need to continue our growth and our training, studying, equipping our people, because we need something very attractive for our youth. Music, videos, interaction. So we need notebooks, pens, pencils, manuals, videos. And in the case of the teenagers that are already pregnant, we are looking for a place where we can store up diapers, medical supplies, vitamins, both for her and their baby, and even a vocational training center where we can train them how to work and get money for the provision for her and her baby. Not just that in that place, in that municipality called Juan de Villegas, but we want to create that there as a pilot center and then take it to other places and become a reference or a model to other places.
This week I held a baby that whose mother is 17 years old. Her grandmother is 34 years old. Her great-grandmother is in her early 50s. And her great-great-grandmother is about 70 years old. As I held that baby, I sensed something of the passion that Dr. Maria has for this need. It is a huge opportunity for the Church of Venezuela. The Church of Venezuela is claiming this opportunity as God ordained and has raised up Dr. Maria to lead this effort. I want to thank you for your giving, for your prayers, your support. I want to invite you to come to Venezuela to help. You can make an eternal impact on thousands and thousands of lives by doing a very little bit to try to help with this need. Whatever you can do will be appreciated. Thank you so much. Dr. Maria, thank you so much for the passion that you have for this ministry. Thank you for the years you've invested in training, for the competency you bring to the work, for your tremendous ministry for Christ, but leading this nation in addressing a need that is corrupting the whole culture. You're a hero of the faith to me, and you're a dear friend, and I appreciate the opportunity I've had to get to know you, and I hope that many more people will come alongside you to work with you and support you in reaching this nation for Christ and redeeming what is really a very difficult social problem. Thank you, and God bless you, Dr. Maria.